My name is Lacey Alanna. Welcome to my channel. This is actually going to be my first video. I felt really compelled to make a video just because of my journey with autoimmune disease, amount of time that I spent looking for videos like this one and not being able to find anything that talked about autoimmune disease in this way. This video is going to be all about my autoimmune disease diagnosis, what my treatment is, and how I got diagnosed. So my diagnosis is undifferentiated connective tissue disease, which is also called mixed connective tissue disease. And it is basically a disease that shows signs and symptoms of multiple autoimmune diseases. So primarily I show symptoms of lupus and also symptoms of rheumatoid arthritis, although not typically as severe, and usually undifferentiated connective tissue disease does not involve like major organ damage. Usually undifferentiated connective tissue disease is treated the same way that diseases like lupus and rheumatoid arthritis are treated. So I'll get into that toward the end of the video of like what my treatment plan is. I kind of want to talk about my story of how I got diagnosed. Another symptom that I experienced was just like rashes. I've always had like really bad eczema, and that is actually autoimmune related. I had really bad breakouts on my hands when there would be a flare of the joint pain, and I had a sore throat for maybe 6 months. I had also been to an ENT, an ear, nose, and throat doctor, about the sore throat. They kind of like put this scope down my throat to look at everything, and they said that everything was pretty normal. I've always had bad allergies, and so I thought maybe the sore throat could have been related to allergies. I quit a job because I thought that talking so much on the job was making my throat hurt. These symptoms were really starting to like affect me and really starting to impact my life in pretty significant ways. I had gone to the emergency room maybe 4 or 5 times in a year or 2 years, just for the joint pain, the hip pain. So I finally had a doctor who referred me to an orthopedist for the hip pain to kind of do an MRI and see what was going on, maybe some like osteoarthritis or something like that. And so I got an MRI, and there was nothing shown on the MRI. Everything was perfect, and the orthopedist is like, yeah, there's nothing there. We'll definitely figure it out. Don't worry. So after I got the MRI and everything came back clear, I got an appointment with a really good, well-known hematologist, because I do have sickle cell disease, which is what I thought was causing a lot of these problems. Although previously in my life, the sickle cell had been very mild and I did not have a lot of issues. So it was just very strange that I was having like all of this hip pain, this fatigue, this overall sick feeling all of the time. So I did visit the hematologist, and she told me that the type of pain that I was having, the hip pain, the knee pain, feeling unwell, was not common in sickle cell disease, and it wasn't typical, and she didn't think that it fit kind of the criteria for what normal sickle cell pain would be. So at that time, she administered or ordered labs, including an ANA test. And there were a couple that came back abnormal, but the ANA came back negative. And I didn't even know that my RNP antibodies at that time were elevated. They were dramatically elevated, and I was not really notified by the doctor. And she kind of put in the notes, that was strange. So after my ANA test came back negative, but my RMP antibody test was positive, I did not know about that. And I moved. And in the new city that I moved to, I found a great primary care doctor who I'd been seeing. And I saw her for some back pain. And at that time, during that appointment, it also came up that I had been having hip pain, increased knee pain, and also pain pretty much in every joint of my body. So she sent me to physical therapy, but she also ordered that ANA and those autoimmune labs. So at that time, I came back with an elevated RMP for the second time, and she actually referred me to a rheumatologist. Rheumatologists are notoriously difficult to get an appointment with. I was lucky enough to be able to get in with one within a few weeks. And again, my symptoms were pain in pretty much every joint. So ankles, wrists, fingers. I started to not be able to open things because of the pain in the joints in my hands, the trouble walking because of the hip pain. I definitely had to have a decreased level of activity. I just wasn't a normal 20-something-year-old person. Very intense migraines and very severe fatigue. So just being tired all of the time, I couldn't finish or complete any task around the house because I was so fatigued all the time. So when I saw the rheumatologist, she did a complete full workup of labs again. And this time she did the ANA, and she did a bunch, just like so many other tests. And she assured me, we'll definitely figure out what's wrong. She was convinced that I had lupus, so I started doing a lot of research just to see what lupus was. During that process, I started to experience chest pressure. There was also a day that I was driving and my arm muscles felt too weak to actually hold my arms up. It became difficult to do my hair because of the weakness in my arm muscles, but also because of just the persistent joint pain in the hands. And that was all kind of around the time that I was about to go see the rheumatologist. And I started to write down every symptom and just keep a really good record to be able to really pinpoint to the rheumatologist what symptoms I was experiencing and to help with the diagnosis, because autoimmune diseases can be really difficult to diagnose. At this point, I had seen an orthopedist, an ear, nose, and throat doctor, a primary care doctor, a hematologist, and nobody could really figure out what was going on and why I was having so many symptoms, and looked at everything holistically to see what kind of symptoms I was having and how they could relate to each other. So the rheumatologist got my lab results and found the same thing: negative ANA, really high RNP antibodies, and some complement levels that were off. So she was pretty confused about what my diagnosis would be, and she immediately put me on a low dose of steroids, prednisone, to see if that worked and see if that could kind of control my symptoms, and that would give her more information about whether this was indeed autoimmune or not. I started the steroids, and immediately, within the first 24 hours, I felt a world of difference. About 2 weeks later, at my follow-up appointment, my rheumatologist decided to put me on Plaquenil, hydroxychloroquine, the COVID-19 drug, and to keep me on the prednisone to kind of control the symptoms short term. So my diagnosis was undifferentiated connective tissue disease or mixed connective tissue disease. The treatment so far has been the Plaquenil or hydroxychloroquine and also the steroids. And recently, sulfasalazine was added to kind of control the joint pain, because some of the symptoms that I still experience even on the medication are like pretty mild joint pain, although the fatigue has improved so much. That is my autoimmune disease diagnosis story. If you have a similar story or questions, please comment down below and let me know. I know when I was like kind of on this journey and looking for more information and looking for answers and feeling so alone, and that I was looking for a community where I could talk about this and I could talk about my diagnosis and I could talk about the frustration. So please comment down below. And if you are having a really difficult time getting diagnosed with an autoimmune disease, just keep looking and look for a doctor who treats symptoms and not diagnoses. One of those. Look for a doctor who treats symptoms and not necessarily diseases, and who listens to you and who hears you and values you. And that is the most important thing, because I had so many doctors overlook these issues and I suffered for way longer than I had to. So that is the moral of the story. Find a doctor who listens.